Welcome to Med Madness, where we delve into key medical topics to help you ace your USMLE exams. Today, we're focusing on a crucial aspect of postpartum care, contraception. Choosing the right postpartum contraception involves considering several factors, including the time from delivery, breastfeeding status, patient-specific risk factors, and the desire for future fertility. Let's begin with the timing. For patients who are less than 1 month postpartum, certain contraceptive options are off the table. Specifically, estrogen-containing contraceptives are avoided during this period. The reason is twofold. They increase the risk of thromboembolism due to estrogen-induced hypercoagulability, and they can negatively affect breastfeeding. In contrast, non-hormonal methods like the copper-containing intrauterine device, or IUD, and progestin-only contraception are often preferred. However, the choice isn't always straightforward. For instance, in patients experiencing heavy menstrual bleeding complicated by anemia, a copper IUD might not be the best option. Although effective, it can exacerbate menstrual bleeding and worsen anemia. This is where progestin-only contraception methods shine. Not only do they help decrease menstrual bleeding, but they also provide reliable contraception without the risks associated with estrogen. For patients desiring reliable contraception to avoid another short-interval pregnancy, progesterone-based, long-acting reversible contraceptives are often the best option. These include the subdermal progestin-releasing implant and the progestin-releasing IUD. These methods boast high efficacy rates, over 99%, in preventing pregnancy. They don't increase the risk of thromboembolism and have no adverse effects on breastfeeding. These devices can be inserted immediately postpartum and can remain effective for up to 7 years. Moreover, they have the added benefit of reducing menstrual bleeding, which can lead to amenorrhea and a subsequent reduction in anemia due to blood loss from heavy menses. Barrier methods, such as condoms and diaphragms, are also an option. They don't affect thromboembolic risk or breastfeeding, but they come with a caveat. Their contraceptive efficacy is relatively low, around 82%. Progestin-only oral contraceptives, while not impacting breastfeeding or thromboembolic risk, also fall short in terms of effectiveness. With an efficacy rate of about 91%, they are less reliable due to high rates of user error and the necessity of taking the pill at the same time every day. In summary, for postpartum patients who are breastfeeding, progestin-only contraception methods such as the subdermal progestin-releasing implant and the progestin-releasing IUD are preferred. They can be initiated immediately postpartum, do not increase the risk of thromboembolism, and do not interfere with breastfeeding. Let's consider a real-life case study to bring these points into context. Imagine a patient, Emily, who recently gave birth and is less than a month postpartum. She's breastfeeding and has a history of heavy menstrual bleeding, which has caused anemia. Emily is keen on avoiding another pregnancy soon, given her current situation. Her doctor advises against estrogen-containing contraceptives due to the risks associated with her postpartum status and breastfeeding. Considering her heavy menstrual bleeding and anemia, the doctor also rules out the copper IUD, which could exacerbate her condition. Instead, they discuss progestin-only options. Emily decides on a subdermal progestin-releasing implant, appreciating its high efficacy and the convenience of not having to remember a daily pill. This choice not only provides reliable contraception, but also helps reduce her menstrual bleeding, addressing her anemia. Emily's case highlights the importance of tailored contraceptive counselling in the postpartum period, ensuring that choices align with individual health needs and lifestyle preferences. That wraps up today's episode on postpartum contraception. We hope this information helps you in both your studies and future medical practice. Stay tuned for more insightful discussions on Med Madness.